Hey, this is Scott Lara. I want to give you some breaking news on the VA veteran front. And I'm going to read some of this just so that I can make sure I get it right. VA to give veterans 1-year authorizations to seek care from private providers in 30 specialties. I'll have all the details in the description. But thank you, Secretary Collins. Now, we've all been talking about Secretary Collins, being up in front of Congress, answering tough questions. Congressmen, senators, what about rural? What about this? What about that? And then Secretary Collins got beat up over the 80,000 number about people at the VA being let go. And of course, we know that a large number of people that work at the VA are, wait for it, veterans. So you're laying off veterans that are working at the VA. But let's talk about this story. VA to give veterans 1-year authorization to seek care from private providers. Now, the thing is, we all know about community care, right? I had to get community care about 2 years ago when I had to have dual inguinal hernia surgery. The VA had a backlog on hernia surgeries. So I had to, request and was granted to go to a civilian hospital to have my dual hernia surgery. And so it's saying that veterans seeking care in the Department of VA Community Care Program in 30 specialties will not have to get reauthorization from the VA for a year under a new policy announced on Monday. Now let's talk about these specialties. Let me scroll down to these specialties. Cardiology, dermatology, endocrinology, neurology and otology, ENT, gastro, urology, urogynecology, psychiatric outpatient, family couples psychotherapy, mental health, nephrology, neurology, nutrition intervention services, oncology, eye exams, optometry, orthopedic hand, orthopedic general, podiatry, and there's a list of them. So I just want to take a moment. I am so glad that the VA is understanding that the wait times for veterans to be able to get care is not acceptable. For those of us who are veterans like myself, I'm a U.S. Navy veteran, we all raised our hands, put our names and our bodies on the line for our country. The least our country should do for veterans is to take care of us. If it is tinnitus, or if it's burn pits, or Camp Lejeune, all those things, the government has a responsibility to take care of us, right? And I have a relative who was in the first Gulf War and is suffering from certain things, and he had surgery the other day for something, and so bone spurs, let me just say that. So the thing is, thank you, Secretary Collins, thank you, Congress, thank you, President Trump, for allowing us veterans to be able to access community care without all the red tape. If you have any questions, just look in the look in the description. Has all the details from military.com. Scott Lara, have a great day.